What are the different types of mercy killing? Have you ever wondered about the different types of mercy killing and how they fit into our understanding of ethics and morality? Mercy killing, also known as euthanasia, involves intentionally ending a person's life to relieving suffering. This often occurs in cases of terminal illness or severe, unrelievable pain. The topic is complex and raises many ethical questions, especially when considering cultural differences and moral values. Let's break down the main types of mercy killing. First, we have voluntary euthanasia. This occurs when a person who is mentally competent makes a conscious decision to end their own life to avoid further suffering. They explicitly request assistance in dying. This type is often seen as the most ethically acceptable because it respects the individual's autonomy and consent. Next is non-voluntary euthanasia. This happens when a person cannot give consent due to conditions like being in a coma or having severe cognitive impairment. In these cases, others make the decision for them, aiming to relieving suffering. This type raises significant moral concerns since the individual's wishes are unknown, making it a contentious issue. Then, we have involuntary euthanasia. This occurs when euthanasia is performed against the will of the person or without their consent, even if they are capable of consenting. This is widely viewed as morally wrong and is often equated with murder, as it violates the person's right to life and autonomy. Now, let's discuss active euthanasia. This involves directly causing death through actions like administering a lethal injection. Active euthanasia is heavily debated in ethical discussions because it requires deliberate intervention to end life. On the other hand, we have passive euthanasia. This involves withholding or withdrawing life-sustaining treatments, allowing the person to die naturally. Some view passive euthanasia as more ethically acceptable because it allows the disease to take its course rather than directly causing death. Lastly, there is physician-assisted suicide. In this case, a physician provides the means for death, such as prescribing lethal medication, but the patient self-administers it. This respects patient autonomy but still raises ethical questions about the role of medical professionals in ending life. Understanding these types of mercy killing helps clarify the moral and ethical challenges involved. Different cultures have varied attitudes toward these practices. In some societies, certain types of euthanasia may be accepted under strict conditions, emphasizing compassion and relief from suffering. In contrast, others may reject all forms based on the belief in the sanctity of life. The distinctions among these types are essential, as they involve different considerations of consent, intention, and the value of life. Voluntary euthanasia and physician-assisted suicide highlight respect for individual choice, while non-voluntary and involuntary euthanasia raise serious concerns about personal rights and dignity. Active versus passive euthanasia also brings up debates about the moral difference between killing and letting die. As we navigate these complex issues, it is vital to consider the cultural context and moral values that shape our perspectives on mercy killing.